Presentation is on free medications. The scenario we have is you have no way to pay for a medication prescribed by your doctor. What are your options? What resources are available to you, and how do you go about applying for them? We were able to look into some local pharmacies and community organizations and private programs to find ways to apply for free medications. One of the local pharmacies we found was Publix, and Publix Pharmacy offers certain medications for free. They offer metformin, amlodipine, lisinopril, and about 5 different types of antibiotics for free of charge. All you have to do is take your prescription in to be filled at the pharmacy. Some of the private programs we looked into, one of them was Salix Pharmaceuticals, and it has a patient assistance program that patients can apply through if they are prescribed a medication that Salix manufactures. And their application can be found on their website under corporate responsibilities, and you can apply on there through that program. Ubix Pharmacy Services offers low and predictable cost medications as well. They aren't necessarily free, but they do have their patient assistance program, and they're consistent with their lower cost pharmaceutical products and their prescriptions. The other private program we found was Pfizer Pathways. It provides 3 different possible plans that you can apply for based on the medications that you require. Some of the qualifications we wanted to look into, one of the biggest programs you can apply to is Medicaid, and it's a government program. And the qualifications that we have listed are based on the state of Utah. Each state has different qualifications for the Medicaid program. So one of the biggest qualifications that they look into is the income level. So if you're an individual, the poverty guideline for that is $12,060. But if you're maybe a family of 4, you have the income level of $24,600. And some other qualifications that they look into, you can't be insured by anybody else. They look at that income poverty line, and they also look at your assets. Your assets have to be less than $2,000 in the bank, and they can also look at your assets like your car, maybe if you got a new car, things like that, and they can actually decline people based on those assets. Another qualification is that you're a US citizen or you've had your green card for 5 years or more. And again, it just depends on the state you're in when you apply for Medicaid for those free medications. With Pfizer, you qualify through the types of medications you use. There's the 3 different programs, and based on those programs and the medications you have, you'll be able to fit into one of the plan categories. For the Salix Pharmacy, there's no prescription coverage allowed from anybody else. Your income has to be at or below 200% federal poverty level, or you also have to be a U.S. resident. They also look at medically verified diagnosis conditions. They want to make sure that you're actually having the problem and you have a purpose for the medications you're requesting. Looking at some of the processes and applications, first of all, Medicaid. If you're going to apply for Medicaid, you can visit the medicaid.gov and look up the state you're wanting to apply in. You can also click on Find Out if you qualify, and in there, you can enter basic information such as the number of households, people in your household, and also the household income. And if you qualify, it will kind of let you know, and you can download the application from there and move forward with applying and receiving those free medications. There's also the Medicare program. If you're eligible for that, there's Medicare Part D, and that is a plan that is drug coverage. Looking at Pfizer RX Pathways, this program has 102 different prescriptions that they cover. It's a prescription assistance program, and it has 3 medication coverage plans. There's A, B, and C, and so your medications are listed based on those different plans and which ones they fall into. So to apply, you'd visit the website and check the medications that you need that they're offered. And the medications, again, are listed for the specific programs. and you can download the application that best suits the prescriptions that you need, the medications you need based on the programs that they offer. So I believe it's plan A is basic prescriptions, basic medications. Plan B is more specialized medications, and plan C is vaccinations. And so based on what you need, you can apply with the program that they list, which whenever suits the needs that you have. In the applications, there's two different sections. There's the patient and prescriber portions, and so both of those need to be filled out, and then you can mail in the completed form and receive a response on eligibility, and then move forward with your free medications. One of the biggest tools that we found that helps find programs is called Partnership for Prescription Assistance. And this is a search engine, and it's just a program search tool. If you have a list of your medications, you can enter them into this system, and they'll provide you with possible eligibility programs. And once you find those programs, you can pick the ones you want to apply for and follow the application processes on those programs. Some other options that we advise is to talk to your doctor. Doctors know a lot of the different programs that provide prescription assistance, or they may have on hand rebate cards or discount cards for the prescription that you may be receiving from the manufacturer. We'd also recommend that you visit the local pharmacy. It's good to talk to a pharmacist. They're a good resource on finding patient assistant programs that your medication may fall under, and whether it be from a manufacturer or a group. And so there are a ton of different resources, programs, and manufacturers that offer prescription assistance programs and help patients to obtain the medications that they need. And majority of the applications are very straightforward. They'll just ask for demographic information, financial information, and of course the prescriber and prescription information that you have. It can be difficult sometimes to possibly find the medications that you need on specific programs. And so that's why it's nice to be able to have a variety of different programs and find the one that best fits the needs that they may have. So this summarizes up our search on free medications and where you can find them, and the experiences that we had. There's many different local places and even places on the internet that you can look up to help you find the programs that you need to help pay for the medications that you're prescribed by doctors. We would look forward to your questions and comments, and we will discuss them on the discussion board. Thank you.